Can a cervical kyphosis be corrected? It's one of the most common questions that I get asked on my channel. I have many videos about cervical kyphosis and military neck. Go check out the videos on my channel. In this video, I'm going to show you a case study of one of my patients with before treatment and after treatment x-rays at 3 months and long-term follow-up at 14 months and show you how we got a correction of her mid-cervical kyphosis and also improvement in her pain and overall health status. Hi, I'm Dr. Walter Salubro, corrective care chiropractor in Vaughan, Ontario, Canada. I'm advanced trained and certified in Chiropractic BioPhysics, which is a full spine structural rehabilitative technique for correction of spinal distortions and postural distortions. It has over 340 research publications already published, and many are in review. And what this channel is about is giving you tips and strategies on how to bend, move, and lift easier. Tips and strategies on how to exercise and strengthen your back and stabilize your back, and also introduce you to corrective chiropractic techniques. Like this, you can get your life back to normal again. So if you want to learn more about these tips, strategies, and corrective care, then go ahead and subscribe right now. Like this, you don't miss out on my next new videos. And also let me know in the comment below that you subscribe, and I'll personally reply right back to you. Now be sure you watch right to the end of this video. Don't miss any parts, because I'm going to go through a PowerPoint presentation with postural pictures before and after, x-ray pictures before and after, clinical presentation, health status questionnaires of a 34-year-old female patient that we saw in our office, that we showed how we improved her cervical kyphosis. You'll see before and after x-rays at the initial 3 months and 14-month follow-up. This is the exact same case presentation that I presented at the Chiropractic BioPhysics 45th Annual Conference in September of 2023. It was also published in a scientific journal that you see here on the screen. Now, before I dive into the case study presentation in just a moment, let me show you what a cervical kyphosis looks like and what the clinical relevancy is. First, we have to see what normal is. So here's a spine model. Now, in the cervical spine, the actual configuration, the shape of the cervical spine approximates the shape of a circle. It's been validated in research, it's been studied from the lateral view, from the side view. So there's these bones here, there's 7 bones, and it approximates the shape of a circle. So on your x-ray, we can take a picture, an x-ray of your neck, and on your x-ray, I should be able to measure a circular configuration with known normal values, average values, globally, and also segmentally, okay, with each segment. And if you're close to normal, that's good. There's little issues with neck pain and disability. But if you're away from normal, then it's going to cause problems. So a kyphosis would be the opposite. If the neck is actually reversed in the opposite position, okay? So that's a kyphosis, an actual spinal distortion and known pathology. It's not normal to have a cervical kyphosis. It's not caused by muscle spasms or muscle tightness. This is a true spinal distortion, and when it occurs, when it's in the opposite direction, it's been shown to have 18 times correlation to neck pain and disability. So it's a serious problem. No matter when it occurred, that can cause issues in someone's life in terms of pain, disability, and all sorts of things. Okay, so in this case presentation of one of my patients that I presented at the CBP 45th Annual Conference and also got published as a case study, I show how we got a correction of this cervical kyphosis into an improved lordosis and also the health outcomes that we got for this patient. So follow me into the next scene and you'll see this presentation now.
Okay, let's dive right into the presentation. The title of the presentation, when I presented it at the Chiropractic BioPhysics 45th Annual Conference in September of 2023, was this: improvement in health-related quality of life in 34-year-old female following reduction of mid-cervical kyphosis using chiropractic biophysics methods. A case report with 14-month follow-up. So this was a patient of mine, and I got consent and authorization to create a case study and publish a case study by this patient, okay? So let me give you some history. 34-year-old female, that was my patient, and the chief complaint was constant grinding feeling at the base of the neck discomfort, muscle tightness, neck weakness. She was concerned about her posture. She had low back pain with sitting, and she had right side TMJ pain. The neck discomfort and grinding she rated at 7 out of 10, and the low back she rated 2 out of 10 on a scale of 1 to 10, where 10 is the worst. She was in a motor vehicle collision in 2012, had a side impact, was a driver, and sustained neck injuries and neck pain at the time. neck, shoulders, muscles felt tired, but no treatment was done in 2012. In 2014, she sustained another motor vehicle collision, was rear-ended, was the passenger, had intense neck pain, headaches, 7-month treatments were done, typically physio, exercise, massage, chiropractic adjustments. She stopped because of the grinding sound, she said, also got acupuncture, ibuprofen medicine. Overall, she said these therapies helped reduce the neck pain in 2014. So you can see that she's had chronic neck pain, chronic neck issues, and 2 incidences where there was a mechanism of injury to her spine and her neck. Now, prior to coming to my office, since 2014, and she came in about, I think it was like 2021 or 2022, somewhere like that, but received care as needed throughout different clinics and practitioners. She got acupuncture, chiropractic adjustments, physiotherapy, exercises, soft tissue massage, all prior to coming to my office. She would get regular flare-ups of neck pain. She didn't feel like the neck was improving, and her neck felt weak, and her neck felt easily aggravated. That was her presenting symptoms and presentation. Okay. Now, she had MRI studies in 2021, which showed mild to moderate broad-based disc bulge at C5, C6, minimal disc bulging at C4, C5, changes minimally increased compared to the previous 2015. So she has a history of disc injuries and disc bulges in the mid-cervical spine as well. Neck disability index. So we give questionnaires to our patients to assess, get their subjective findings of their pain and disability, and then objectify it with an actual rating. And these tests and these surveys are all standardized and been validated through research. So neck disability, 6 out of 50, so that rates a mild disability. Revised oswestry, 6 out of 50, that's for low back. And then Roland Morris, 1 out of 24. So she doesn't really rate her pains as high. She's more concerned about the stiffness and the grinding in her neck. And I also do what's called an SF36 health status questionnaire, which is also highly validated and also used in a lot of research studies. And this rates across multiple health domains: physical functioning, role limitation due to physical health, role limitation due to emotional health, energy, fatigue, emotional well-being, social functioning, pain, and let me back up a little bit, and general health. Okay. So those are her scores. Okay. So we'll come back to these scores and compare them later on in the presentation. Okay. Initial exam. So within examination, we found that her neck range of motion was limited in right rotation and had full range of motion in all other ranges. Her low back range of motion, lumbar spine was full with no pain. I checked her grip strength, which was 41 pounds on each side. And she had mild tenderness in her neck muscles. And I also did what's called the posture screen, which is a mobile app on the iPad, and it's used to do postural assessments. Okay. And also did digital x-rays. So I'll show you those right now. So here's the initial posture assessment. So the green line represents normal, red line represents the patient. Patient's looking at us in this one here. So the yellow dots, the yellow circles with the black in the middle, that represents where the eyes and nose are. And so we use these standard points in the assessment so we can repeat this over and over at each assessment. You'll see that the head position is off to the left. So there is a translation of the head to the left. The left shoulder is tilted. Okay, the shoulder complex is also shifted to the left. And there's a mild head tilt to the right. Okay. And then when you look at the sagittal postural configuration, there's a forward head position. So the ear. So this one here by the head position, that's where the ear would be. Is way too forward compared to the shoulders back compared to the pelvis. So there's a forward head translation, a posterior or backwards rib cage translation, and a forward pelvis translation. So there's 1, 2, 3, 4, at least 4 postural distortions just from postural observation. X-rays, these are initial X-rays, okay? So the one on the left here, you're looking at the AP view. So we're looking at the patient from the backside, and I draw a green line at T1, 2, 3, 4, 5. T6 is my reference point. And basically the C2 vertebra at the top of the red line should match up with the green line, and it doesn't. So we look at what's called X-axis translation. Okay, so that's a C2 to C7 translation of 10.2 millimeters, which is significant. And there's some rotation and lateral bending occurring in here as well. And then the lateral X-ray. So you can clearly see that there is a kyphosis. Okay, so the green line represents a normal alignment of the spine. Okay, so from C2 to C7 should be 42 degrees. And this yellow line represents the atlas plane line to the horizontal, should be 29 degrees. And then this vertical line to T1, superior posterior corner of T1, this measures the posterior posterior tangent sternal incident angle. I'm not going to go too deep into what all this means. What I want to focus on is the kyphosis. So there is a serious loss of normal lordosis. Okay, so a cervical kyphosis is not normal at all. We can measure this. I can measure the global alignment, which is the ARA, the absolute rotation angle, and the individual alignment between each vertebra called the relative rotation angle. So if we look here, C1, look at the table, segment C1 to horizontal, normal should be 29 degrees. This line here should be 29 degrees to the horizontal. It's 17.5, so that's not good. And then if we look at the mid-cervical spine, C3, C4, C4, C5, C5, C6, they're kyphotic. So negative means that's extension, that's normal for the cervical spine, lordosis. Positive number means it's inflection, that's kyphosis, which is abnormal for the cervical spine. So she has a mid-cervical kyphosis and a compensating extension at C6, C7, and then again, some kyphotic segments at C7, T1. So the global C2 to C7 arc that should be normally 42 degrees is -1. So she has a serious misalignment of her neck called the cervical kyphosis. Okay, so the treatments. We did 12 weeks, 34 visits in my office. 30 visits include chiropractic biophysics, methods, and tractions. Okay, I also did Thompson drop adjustments on every visit. And then when we started the mirror image traction and exercises, we did mirror image adjustments, standing with an impulse instrument in the coronal and sagittal plane to improve the posture. And then we also did adjustments posterior to anterior into the cervical curve, into the kyphosis at C5 with impulse adjusting instrument and also drop table. And I used an actual device called the L-SPA. It's called the lobe sagittal plane adjuster at C5 as well. One thing I want to mention too at the X-ray, it's going to be hard to see, but there's an anterior listhesis here. I believe it was at C4. So that means there's actually disruption in the ligaments here because of the wear on those ligaments because of the abnormal loads of the head on the front part of the actual spine. You can see arthritis degeneration at 2, 3, 4 at C5. So that's C5, C6, the C3, C4, and the C4, C5 is the highest point of damage, not just on the spine, the discs, but also ligaments, which is typical for cervical kyphosis. Okay, then in-office structural rehab / traction, which was CBP protocols, chiropractic biophysics. And so I did, in addition to the chiropractic biophysics, we did neck stretching, isometric relaxation. I used a pro-lordotic neck exerciser. If you've seen any of my videos, I talk a lot about that. So we did some reps of those. Mirror image adjustment, which is now the CBP technique. Sorry, mirror image exercises. So mirror image exercises in the coronal and sagittal plane. And then we did two-way cervical extension traction using a universal traction system. Started with 3 minutes of hold time in the traction position and worked up to 15 minutes in the office. And we started with 15 pounds front weight and went up to about 25 pounds. And I'll show you pictures of these in a moment, okay? And then the home exercises were prescribed. So mirror image exercises for coronal and sagittal postures. Again, so they're doing exercises in the office and also at home. So every day they're doing something. And that's the protocol for the exercise recommendations. Hold for 10 seconds, start with 3 to 5 reps, work up to 20 reps daily. Again, pro-lordotic neck exerciser was dispensed and used at home for 45 reps. And we gave a cervical dendral, which I'll show you in a moment in a picture what it looks like. Medium cervical dendral placed at C7 for 20 minutes every day, which she did every day. So here's some examples of the adjustment techniques. That's me adjusting the patient. The top left picture, you see P to A, posterior, anterior, right into the cervical curve. Normally, I would extend the neck a bit more to get a nice lordosis in there and get those bones and spine moving. The one on top right is the lobe sagittal plane adjuster, the L-SPA. You can see the neck is bent over, so we're actually improving the kyphosis. So we're reducing the kyphosis, improving the lordosis, getting nice extension over this ropey thing here, and we drop the neck into the drop table to get a two-way adjustment. Bottom left, you see an impulse instrument. It gives an actual set amount of force with every tap into the spine to get a nice quick adjustment into the C5, C6 area to get more action into the cervical lordosis. So we're trying to reduce the kyphosis and build in that cervical lordosis. And then the bottom middle and bottom right, you see me acting on the actual L spot with the patient driving their head down to get that two-way adjustment into the actual neck, okay? All right, here's some of the exercises she did. It's called the pro-lordotic neck exerciser. Started with red, went on to blue, which is a little bit tougher. So you see she's pulling the head back as she's counter-pulling the hands forward, getting an actual extension into her neck and improving the lordosis in her neck. And then over here on the right, that's the UTS, the Universal Traction System. There's different ways we can set this up based on the patient's assessment. For her, because I want to keep the head a bit into extension and get get the neck into extension also with a lordosis, we have a static hold going backwards and a dynamic pull with the weight. So this green and silvery weight over here is pulling down to the ground. So that's a dynamic pull down with a static hold back. And you see her neck is pulled into extension. So we're kind of replicating the pro-lordotic neck exerciser, except that on the left, the pro-lordotic neck exerciser is a repetition movement, and the actual static traction is working on those ligaments, those ligaments held in place properly. Okay, so this is typical chiropractic biophysics technique. So it's three-pronged approach. There is mirror image adjustments, mirror image exercises, and mirror image traction. Okay, so 3 months. So after her first 3 month of care, we did follow-ups. Okay, and actually did follow-ups on month 1, month 2, month 3, but this is her 3 month outcomes. So subjectively, she told me that the neck grinding improved by 50%. So it's a 1 out of 10 at 2 months. And that's when I asked her about the pain rating, but overall it improved 50% at 3 months. And she was able to hold her neck and her head more comfortably, and it felt more right positionally on her shoulder. So that was good for her. Low back was still present with bending movements at 2 out of 10 at 2 months. And then the TMJ improved by 50% at the end of 3 months. Objectively, what I measured, her cervical range of motion was full in all directions. The right rotation, which was originally limited, is now improved. And there was some pain with extension still. Full range of motion. Grip strength was about the same. So that wasn't really a factor in terms of a limitation at the beginning. So that was good that we confirmed that. There was still some mild tenderness on the neck muscles. And then I'll show you the scores of the questionnaires and the X-ray findings next. Okay. So here's the questionnaires. So I repeated the neck disability questionnaire, and it went down from 6 out of 50 to 2 out of 50. And the revised Oswestry went from 6 out of 50 to 6 out of 50. So that didn't change much. And the Roll Morris also stayed the same. So there wasn't really any clinical difference with those questionnaires, except for the neck disability, which was our main concern anyways. Now the SF36, which measures our overall health status based on the questions and answers, you see that there's some significant changes in physical functioning with the bold one here, 95 from 80. The role limitation to physical health from 0 to 75, that's huge improvement. And then role limitation for emotional health went from 67 to 100, so that's clinically significant. Emotional well-being went from 48 to 92, which is also clinically significant. And then her postural improvement. So at 3 months, so look at her coronal posture. So the left one, she's wearing the purple shirt from the front, and at 3 months, the red shirt from the front over here. So you see there's an actual nice correction. Okay, actually a bit more off center, but that's okay because it tends to neutralize and centralize later on. Okay, and then from the side, you see her beginning to make some changes with her pelvis, improving, but still more work needs to be done with the actual thorax. But overall, that head position is improved, and the thorax is a bit more back because we worked on these things, and the pelvis is also in better position. X-rays. Okay, so initial versus 3 months. Now, you can see on the left side in the coronal plane that there's an improvement of the side-to-side translation of the actual head and neck. Okay, so it went from 10 millimeters off center to now 1.7. So that was a nice improvement in there. Okay, and in fact, it went a little bit more to the opposite side, which is really good. And then look at now the initial lateral X-ray here in 3 months. So her ARA was -1, which is very, very bad. There's a mid-cervical kyphosis. And now at 3 months, her ARA improved to 20 degrees, okay, which is a big improvement. And if you look at the segmental angles, the relative rotation angles on that table on the right, C3, C4, went from 7.7% in the opposite direction, in the kyphotic direction, to now rounded off to -6. So now became lordotic. The C4, C5 went from 3.4 degrees to 1.6. So still kyphotic, but less. And C5, C6 went from 9 degrees to 1.9. So still kyphotic, but less. And the hyperextension at C6, C7, which was at 4 went to 5.6. So these numbers are meaningful because we don't want to just look at the spine and look at it visually. We want to measure it objectively. And I showed in this case study so far that at 3 months, we got a very nice correction and reduction of her cervical kyphosis, moving towards an actual lordosis. And if you do some research, you'll know that you'll see that a cervical kyphosis is a pathology. It's not normal. It's not caused by muscle spasms. It's a true misalignment and a structural distortion of the normal alignment of the curve, which would be a C-shaped lordotic curve. And it's been shown to actually correlate to neck pain and disability due to neck pain. When it's kyphotic, at least 18 times correlation, okay? When it's a loss of curve, it's 2 times correlation. So it's clinically significant. And as you can see in the patient's history, that she's had neck pain for a long time after those 2 accidents, car collisions, okay? And now she has a nice improvement. Now, what happened next? Over this time, she came to my office about once a month for maintenance adjustments, just regular adjustments, which was chiropractic drop table adjustments, and also I did some mirror image adjustments into the C5 with a table. And she continued her cervical home dental at 2 to 3 times per week, okay? In fact, I don't know if there's a home dental picture in here, maybe coming up later on, we'll see. And at the 14-month follow-up, so now it's a long-term follow-up, okay, we're going to see now what her neck looks like and her posture looks like. So subjectively, the grinding is still 50% better. She's happy with that. Neck pain is still low, 2 out of 10, and low back pain is low. And her range of motion for neck and low back is full. Grip strength hasn't changed, which is normal for her. And now no more tenderness in her neck, no more neck muscle tenderness. Questionnaires. So neck pain stabilized, the low back improved with a revised oswestry and Roland Morse, no change, which wasn't really significant for her. And then look at the SF36. Okay, so at the 14-month follow-up, so compared to initial, it went from 80 to 100. So it even improved from 3 months. So it went from 80 to 95 to 100. So continual improvement at the 14-month follow-up. Now, during the follow-up time, the actual treatment program was done. She was just doing maintenance care, once a month adjustments, and home dental 2 to 3 times a week. So we see that her health status and her pain condition has held up. Okay, she's doing well. Role limitation is keeping up. Role limitation to physical and emotional health both keeping up. And then now is a nice improvement in the energy fatigue as well this time around. The emotional well-being is better overall compared to initial, dropped down a bit compared to 3 months, and that can be for a variety of different reasons. And the rest stayed kind of stable, okay? Now, posture. So on the left, so 14-month follow-up, nice coronal postural correction. Initial, way off to the left. 3rd month, close to center, a bit overcorrected. And then 14 months, she has a nice stability, full down the center correction. The sagittal posture, looking at the side view on the right picture. Initial, you see the zigzag pattern. Head forward, shoulders back, pelvis forward. 3 months, begin to see some correction in the pelvis, but the shoulders are still back. And then now everything's beginning to normalize. So heads forward a little bit, the shoulders are back a bit, and the pelvis is back forward just a bit compared to the shoulders. So it's much better than the initial presentation. So at 14 months, she's still showing pretty decent holding of her postural correction in the front view and continued correction at the lateral view, okay? X-rays. Okay, now let's look at the left one. So left one, initial. You see the left translation, 10.2 millimeters, and now 14-month follow-up. There's a little bit of a regression, 6.6. That's a lot better than being 10 millimeters over, okay? Now, the kyphosis, okay? So original kyphosis, -1 with mid-cervical kyphosis. At 3 months, we saw a nice correction. So it went from -1 to -20. So it's a big improvement. And at 14 months, she held her improvement. Yes, there was a mild regression here in the mid-cervical area, but overall it held. So it held at -17. So it's a massive, massive improvement at 14 months that held really well in the long-term follow-up. Okay, and you can see the segmental angles are doing pretty well. A little bit of regression at C4, C5, C5, C6, which is expected because when you're doing intense rehab at 3 times a week for 12 weeks and a lot of home exercises is when you expect to get the most changes. But yet at 14-month follow-up, it's still holding up pretty well. And that's my review of this case study of a young woman, 34 years old, that came in with chronic neck issues and grinding and jaw pain and low back pain. And the jaw pain improved, the neck grinding improved, her posture improved, and her cervical kyphosis improved at 3 months, and the improvement held long-term at 14 months.
Hope you got some value out of that, and you learned something new. You saw the techniques that we used in chiropractic biophysics here in my office. Now, one of the most common questions I get asked is, Doc, how do I find a chiropractor like you? How to find a chiropractor that does corrective care or chiropractic biophysics? So what I want to offer you now is a directory of where to find these type of chiropractors that are certified and trained in chiropractic biophysics, and hopefully you can find one in your area. Just punch in your address and your zip code. But what I want from you is some interaction on this video. So comment below under this video, and if you want the directory, say, can you please refer me to a chiropractor in my area, or pass me on the directory, and I'll put it into the comment place below and I'll reply right back to your comment. As well, if you have any questions about corrective care, about cervical kyphosis, about chiropractic at all, then ask me the questions below. If you found value in this video, do share with people. There's people out there that don't know about this, and they need to know about how to correct their spine non-surgically with corrective methods. So share this video, like it, helps the YouTube algorithm, and I have a whole bunch of other videos about cervical kyphosis. I show you how we do the techniques in my office. I put a playlist for you right here, so go to this playlist right over here to watch the next cervical kyphosis video on my channel.